Okay, so here is a question for all of you at home. Have you already had COVID-19? If so, are you a long hauler, someone who has not fully recovered weeks or even months after first experiencing symptoms? Long haulers are the subject of one of the largest studies in the country, now taking place at 8 hospitals, including Rush University Medical Center. It is called the INSPIRE study, which stands for Innovative Support for Patients with SARS-CoV-2 Infections Registry. And joining us now to tell us more about this, what's involved, and what they are learning is Dr. Bala Hota. He is a Chief Analytics Officer at Rush University Medical Center and an infectious disease expert. Good morning to you, Doctor. Thank you for joining me.
Good morning. Great to be with you.
So tell me how long this study has been going on and what fits the definition of a long hauler.
Sure. This study's been going on since about December of 2020. We initially, really sought this as a research question in the middle of last year. As we started noticing that there were some individuals who had persistent symptoms after infection with SARS-CoV-2 or having COVID-19. But there's really a lot that is unknown, and we are really starting to understand the public health impact that these long-term symptoms may have for folks who have had COVID. And what we're seeking to do with the study is really get a handle on what are the symptoms that people have, how common is it, and are there things that people can do to prevent it or optimum treatments for some of these long COVID symptoms.
Okay, so you just started in December, so it's still early, but I'm curious, what have you learned so far, if anything, and what do you hope comes out of this?
Sure. So we have about 700 individuals enrolled throughout the country so far. We are enrolling, throughout the country. So California, Texas, Chicago area, East Coast. So far, we do see that we are having, findings that line up with what nationally we're seeing, which is that, between 30 to over 60% of individuals who have had COVID can have ongoing symptoms. The biggest types of symptoms that people can have include fatigue, ongoing respiratory problems like shortness of breath, some cognitive issues and hair loss, but then there can be more rare findings. The data, we still don't have enough and haven't followed long enough yet to really look at some of the real questions in the field, like are those with an initial mild illness versus more severe illness of COVID more or less at risk of having long COVID, and how long do these symptoms go on? So I think and what's the true prevalence? How common is this? Are we underestimating how much of an issue this may be? So those are some of the real, detailed and deep questions that we want to get into as we conduct the study.
Well, you just said something that kind of struck my attention. You said so far you found that 30 to 60% of COVID patients have some sort of issues up to 6 months later. Is that correct?
Well, it's not necessarily up to 6 months later. It's within 60 days. 30 to 60% lines up with what's been in the published literature. And, and I think it really underlies how this is something that's emerging as a major public health issue. I think some of the things that we're seeking to do with the study is even refine the definitions and be able to also look at mild versus severe long-term impacts.
I'm just
Some
curious.
of what we've seen in what's been published is that people who have had severe courses, just because of being in the ICU, they can have long-term side effects and symptoms, including post-traumatic stress disorder and ongoing anxiety, but also multiple organ issues that take a while to resolve. What we're still trying to do the analysis on, and what we want to understand is it just left over from severe COVID that people have these symptoms, or is there a burden among those with just mild illness?
Right.
That those folks that may not come to the doctor but have issues, and through the type of study that we're doing, we can really detect some of that mild illness, but it's still significant enough to impact their daily life.
Yeah, because my next question was going to be, is there any other respiratory type illness that is similar to COVID when it comes to having these long hauler symptoms? Because it seems like we're finding out so much more than we ever thought could happen as a result of having this.
Yeah, and that's a wonderful question. You know, when you look at the literature, there were two prior outbreaks. So there was SARS, and then there was another outbreak called MERS, MERS, in the last 10 years. And those were very limited. MERS was Middle Eastern Respiratory Syndrome. SARS was, of course, a syndrome similar to COVID, but it was restricted mainly to healthcare workers at the time, and it was eliminated much more quickly. Both of those are caused by coronaviruses, and they both had some rates of long-term effects. But the difference with COVID and SARS-CoV-2 has been there just have been so many more people infected because of the way the pandemic has evolved and how broadly folks have gotten affected by this internationally. We are seeing a much more common impact of long COVID syndromes across public health, across different communities. So that's why I think the public health impact of this, we have to really get to an understanding of how broad it is.
Dr. Hota, I'm gonna have to jump in here now. Very fascinating what you guys are doing. Thanks so much for sharing this information. I know you guys are still looking for some more people who want to take part. So if that's the case, our viewers can go to your website to get more information to find out how to become part of this study. Thanks again for your time.
Thank you.
Have a great day. Coming up.